everyone, welcome to this video. My name is Brittany, and if you're new here, I am a new dentist. I just graduated in June 2020 and I've been currently working for about 2 months now, which is insane because literally living the dream, I guess. This video is about what I wish I did in dental school. So I've been out of dental school for a couple months now, and looking back, there are some things that I wish that I did do. And of course, like, I did learn a lot in dental school, but if I could kind of like rewind time, this is what I would do differently. And I think that this video will be very, very helpful to those of you in your 3rd years and your 4th year. Now, it might be a little different because of COVID-19 and that has affected the way your clinic is run, but I'm hoping, in the future, when things get a little bit different, then you could still apply what I'm saying to your future education as well. So let's get into it. The first thing that I wish that I did differently is I wish that I would have taken learning how to diagnose from radiographs better. So back in dental school, kind of how it worked is that we would do treatment planning with the patient, and I would look through the x-rays, the radiographs, and the teacher would come by and approve it and point out all the things that I missed. Well, the thing is, I wish that I would have practiced so much more with this kind of radiographs and really detecting caries and what type of treatment to do, because I feel like this is so crucial in real dentistry, because if you can't diagnose something and, you're kind of like at a big loss, both for the patient and for yourself. The second thing, which is related to learning how to treatment plan better, is having the patient accept your treatment plan. Out there in the real world, it's so different, especially with the different insurances or the different dental plans. A lot of the times, these insurances don't cover the best possible type of treatment for the patient, and so that kind of gives like a gray area. I do wish that in school that I would have learned how to do case presentation more and learn how to talk to patients and get them to understand, why you need it and why it's worth your money and all that stuff. Why this material is best and why this is the treatment that you should do. And that is something that maybe could they have a class in dental school about that? I don't know. I did not have class about that. It's definitely case acceptance and delivering your treatment plan to the patients and getting them to say yes to it. The third thing that I wish I did in dental school was to really challenge myself with the time given. So back in dental school, we had 4 hours, 4-hour blocks. And boy, oh boy, I feel like we were straight up spoiled. We would have one patient for every 4 hours. And granted, we did everything from x-rays to setting up the chairs and getting start checks and getting swipes from the faculty. But the fact of the matter is, I used to take 4 hours to do one filling. And oh my gosh, please challenge yourself to not do that. Do as many as you can, really push yourself. I remember in my 4th year, one of my teachers was like, you have to time yourself. And I was like, okay, I'll time myself, So I timed myself, but I wasn't so strict about it. So I would say that if you're in the situation where you're feeling a little bit slow, it would be way better if you learned how to practice your speed. Fourth thing that I wish that I would have done in dental school is done more aesthetic cases. So where I went to dental school, it was a little bit difficult because the patient population was definitely a population that needed a lot of treatment done, but their priorities were not necessarily cosmetic or aesthetic cases. So that's something that I definitely would have wanted to get more exposure to, especially if you're working in a more affluent area. There are always going to be patients that really want to upgrade their smile and make it really pretty. Number 5 is probably every dental student thinks that when they graduate, they're like, oh, I wish I would have done more endo. So definitely one thing that I regret not doing as much of is doing more endo in school. So it was a little tricky in my school because we had all of the specialty departments, so anything that was remotely hard would right away get tossed to the graduate endodontic department. And unfortunately, that was not really good for us as dental students at that time because we did not get the exposure that we needed and we didn't get enough. So luckily, thankfully, at where I'm at right now, I've been able to do some more endo, and I definitely feel a lot more confident, but I'm still not at that level where I would want to be. Sixth thing that I wish that I would have done more in dental school is really work on implants. Now again, similar to, that my school had all of the graduate departments, literally so many of the departments could place implants, so the dental students did not really get to. Of course, maybe that could be biting off more than you can chew, to place implants, but I know that some dental schools out there, some dental students are able to place these implants. And I do wish I could have had more exposure with like practicing implant restoration, impressions, screw retained, cement retained, all that stuff. So that's something that I wish that I would have done more in dental school. Seventh thing that I wish that I would have done more in dental school is really learn about the business side about dentistry. Now we did have several classes called practice management in our last year of dental school, but I feel like it was a little bit disorganized, and I feel like I couldn't really get the grasp and really understand the business aspect of dentistry. And this is something that's like really crazy because, they teach us how to be clinicians, but they don't teach us how to be business people. But of course, like down the road, if people had the chance and people were willing to open up their own practice, then it would have been really nice to get some of that background information in dental school rather than trying to learn about it yourself and trying to find mentors, and it's just really hassle. The eighth thing that I wish that I've done in dental school was to make more connections. Oh my gosh, this is like, I regret it so much. I think especially since the pandemic, COVID-19 kind of shut down our school, I was kind of like under an impression that I would have more time to connect and mingle with people, but that didn't happen. And of course, because of the pandemic, a lot of offices kind of closed down, they lost a lot of money, it wasn't good for business, and they're not really in the position to hire associates. So if I could look back, I wish that I were kind of more proactive during the beginning half of my fourth year, maybe even the end of my third year, to really get connected with a lot of people. I know some of my classmates who I think in the beginning of their fourth year already locked down and signed contracts with their employers. So you gotta be like them, you gotta hustle. I tried to talk to my teachers, but I think that the scope of talking to the teachers wasn't that broad. I think I really recommend going to like alumni conferences or anything like that, just to mingle with any alumni. And that person might know somebody, that might know somebody, that might know somebody. Especially here in the US, like everything is really based on connection, and if they like you. At this point, like doesn't matter if you're like the best clinician or whatever, like yes, that's great. Or maybe you got like a 4.0 GPA, that's great too. But it's really about who you know. So definitely if you're in your third and fourth year, hustle to talk to people. Okay. The last thing, the ninth thing that I wish that I would have done in dental school was I wish that I would have been more willing to make mistakes. I think at that time I was just very like careful and trying to strive for perfection, and I was really, really scared and always stressed about making a mistake. But I realize now, back then in dental school, you're still practicing under somebody else's license, and you're still kind of like under the umbrella and under that protection of your school, of your university. So not saying that you go out there and do something crazy, but really like be more proactive and be willing to make mistakes. Not willing to make mistakes, but willing to be okay to make mistakes rather than being really, really careful. Because right now I'm working, I have my own license. I can't go and experiment on stuff, like do things that are out of my scope, do things that are way too challenging for me, because nobody's really got my back. Like my name is on that license, and at the end of the day, I'm liable for everything that I do. So those are 9 things that I wish that I have done in dental school, coming from a new dentist. So hopefully you take everything with a grain of salt what I said. And honestly, you're probably thinking, oh my gosh, these seem so easy, but I've like had people tell me this all the time, but I was kind of like not lazy, but I was kind of like senioritis. Like I was like, I just want to get out of here, and I just want to do like, I just want to go through everything. I just want to pass or whatever, Don't have that mentality, especially now during COVID-19 when it's so limited to find patients. Be proactive. Just go out there, try to find patients, be more proactive with calling your patients, trying to get them in or whatever, like whatever the circumstances is, like this is the only chance you've got, you know, like unless you're gonna do like a GPR or an AEGD, which is great, but think about it, like this year it's probably gonna be super competitive because everybody's gonna wanna go in and get that extra year. Hope you enjoyed this video. Make sure to give it a thumbs up if you enjoyed it, and yeah. And keep watching this channel to find out more about life after dental school and new dentist stuff. I'll be putting in some like pre-dental dental tips like this one sprinkled about, but catch you in the next video. Bye.